I wanted to introduce my new cart. Every 3 or 4 years, I kind of update these carts. This actually is by ASI Dental, and the features are amazing. So we all like to have a curing light. We all like to have an intraoral camera. I have a space here which I'm not using, but sometimes you think, well, maybe I may need another one for Handpiece. We have air and water, and then just air. So you can actually have these options. Ultrasound. This ultrasound, I know everyone's worried about ultrasound now, but you don't hardly get any liquid out of that. You're not going to be spraying yourself. Same way with the electric handpieces, and this happens to be, I'll just take the sheet off, turned on because it's automatically on. You can actually do whatever you want here, back and forth. But I want you to take a look at the head of this handpiece. This is a latch. You can actually use this one also for surgical procedures. And here is the high speed. And look at the small head right there. Latch, fiber, nice, easy going. Now, since I personally like rear, you can move this, if you want it somewhere else to where you're kind of like maybe to the side. I like to have you rear because I have air and suction on both sides. I put the hand pieces to where either a left-handed or right-handed dentist can do this. And this is important because I do a lot of training. I got a lot of right-handed, but a couple times I have left-handed. So it's really easy. In the middle we have an iPod. This is actually came with the B&R hand pieces. And you can actually, if you're in endo or if you're in actually, just push whatever you want, and you will then be able to put in whatever torque and whatever speed you want. You actually have the ability of changing back and forth, you see. A big feature that I think is important. So we have cellophane. After we sterilize and clean everything we possibly can to the best of our ability, we put this all the way down. And as you notice, it's touching everything here. So if you want to touch the iPad for something, you're actually touching a sheet over. So you're not really contaminating. Even though we wear gloves, you have this issue. So once we've cleaned this all down and purged everything, we have actually done our due diligence. Now right here we have the water supply. These water supplies, they have anodyne. It sticks in this. More than likely it'll last for a couple days. And then you just put in distilled water, and then it will actually clean all that up. Now those of you who have to spend a lot of money on evacuation for amalgam, because in our city it was mandated last year that if we had any amalgam, it could not go into the water supply. So there's all these big machines you have in back. This has everything in it. It has the motor, it has the suction, it has electricity. And so this right here will take the liquid, and any particulates of any amalgam will go into here. This generally will change this about once every year. Now, if you're doing taking a lot of old fillings out, you may want to change it often. And then we just put a new one in. So it's got just about everything you want. Extra cords in the back here. If you want, you also have something where you can put your gloves. You can put mask. On top here, I just have an Alexa, but you could virtually put anything here. A little screen. It was just the way I wanted it. So I'm going to show you now another feature, and that's for a dental assistant. If you want to have another cart for an assistant because you want to do maybe side delivery, here's a cellophane. You could drape it. You got cabinet room, which you could actually have it covered for your dental assistant. All of these here can actually be the water and the suction. You could actually pop them on the other side. So you can actually, use these handles, and they can actually have one on either side. So they're very, very versatile. In my last move from one place to another, to this building, before I went to the last building, they gave me a quote of close to $70,000 for plumbing. And I said, gosh, I may sell the building. you know. And if you're renting, why spend all that money? I didn't have to. I just went with the portability carts, and that 70,000 went towards something else. You see, so these have been just God sent for me. Something new that I asked the company if they would do this, and this is the iKaiba Pro. This is from B&R. The cart, once again, ASI built this for me. I wanted everything with one plug. If you have other items, there are plugs in here. You know, right now here you have several little outlets that you can do with. These little holes in here are for other advancements. So for the iKaiba Pro, this is just a great, this is the one that we use for implants. And this is also a small head, even though it doesn't look as small as the smallest. The burr goes in 2 millimeters deeper than any other. And you see right now we have, this is where the saline is going to come out of. I want you to see that we have 2 different heights. So here's your bag. If you're working here, we have another arm that goes all the way up. So you have a little bit more height if you're going to be standing up doing procedures. So you have several of those. And I just wanted to say, in case I need something, I went ahead and had them put this on. You could easily move this. So when you're doing your surgeries, you can move this around. But if you don't need it, you can just take it right off. Boom, it's off. And there you go. In the drawers, we have areas. Okay. I always like to put my saline, make sure it's dated correctly. You also want to have, and I get these from, this is also from B&R. These are all disposable. This is what the cannulas are that carried in the saline. And the nice thing is, and everyone's worried about a lot of spray, we don't have to have that much spray, especially with the Elector's handpieces. I just thought you would like to see some of the new advances. The carts is easy. You can just roll it from room to room. You don't need to get 5 or 6 machines, you know, because you're not going to be doing surgery probably 8 hours a day unless you're a maxillofacial surgeon, for example. So this was just kind of an overview of some of the new things coming out. The advancements are continuing to come. You know, therefore, I would say, if I'm going to get a unit, I'm going to get a portable unit. I don't want something that's stuck there, and then I have to have a compressor in the back. It's all right here. Everything's set. You've got it here. I just thought maybe this would be great for everyone to see, because this is what I use in the office. I love it, and I'm not receiving any remuneration for any of these companies for talking about what I'm talking about. You all know me. I'm Joe Massad, and I tell you the way it is. Talk to you later.